Hi, everyone, and I just wanted to start right away. This is a little bit over-promising here. There won't be nuggets at the end of it, and I'm actually here to more introduce a set of problems that we are dealing with that we believe could be helped by using NLP, AI, machine learning. I personally am at a very baby stage right now, and I'm just learning the vocabulary of machine learning, AI, and NLP. So just had to say that right away. But on the other hand, I also wear a technical hat with some other skills with data from my previous experiences, and somehow I ended up also taking a new role of a community manager at UCSF. So we are trying to start a new NLP community to cultivate expertise with text analysis and create a community of practice and knowledge base for people at UCSF who work on biomedical research to make the tools accessible for them. Anyway, so I hope that you will see something interesting here. So my background, where I'm from Clinical Translational Science Institute, which is focused on infrastructure and services for efficient, effective, and innovative clinical research. We work closely with Institute for Computational Health Sciences. It is a relatively new initiative, and they are building computational research infrastructure. And I'm specifically within the research technology team. So my perspective is a little bit different. I'm not working on a specific research project or a specific research area, but rather trying to find, as part of the team, trying to find tools and approaches that will work for many researchers, many problems. So the main focus is implementation, finding most practical solutions, users who are researchers are in the center of our things, and scalability. So when we choose an approach, we try to assess how many people it will actually help. So my background is an applied math major, but then spent 2/3 of my career so far in industry, and then came to UCSF. Very happy about it, but also kind of have a liaison hat where I try to help researchers to find the right tools to their needs, and also technical hat, especially lately, of working on providing access to clinical data. And so, trying to plant some seeds today for potentially for collaboration, and maybe connecting with you and see how we could work together, maybe, or help each other. So, if you ask a clinical researcher what is your biggest obstacle in your work, maybe you know what they will say. So they will say that getting clinical data is a big pain for many reasons, but I'll name a few. So first is clinical data lives in clinical systems such as electronic health record and other similar systems. So you might know about an EHR called EPIC systems. There, if you go to Kaiser or maybe you see health centers, and if you ask your physician what computer system you're putting in my data, they will say it's EPIC. So they are located in Wisconsin, and the data lives in a relational database. The analytical database has more than 20,000 tables and hundreds of columns in each table. On average, it's of course it's populated here by clinical workflows and some information. Same information could come into the system through different workflows and end up recorded or stored very differently. So you could be looking for the same thing, but it could be hidden in multiple places, and it's a quest in itself to try to figure out where this data is. And so for this reason, and so this, I'm talking about a lot of structured data, and it's, you could say, oh, well, at least this data is structured. You have designated columns for diagnosis, for procedures, for clinical events, So maybe it's already kind of analysis ready, but in practice it's not true. It's very complicated. Only for structured data, average delivery time for researcher would be months. And another big issue is privacy. Since the nature of clinical data is deeply private, regulated, privacy is enforced, it is really difficult to, you would need to justify why you need this data or that. You will never get access to the whole data set or all the data about a certain patient. So these things are what differentiates the world of clinical data from, for example, the public data corpus that you could work with and build machine learning algorithms on. But so this is an example of a painful but realistic exchange between a researcher and data person. So researcher, could you please give me data on kidney transplant patients? Data person, please answer these 25 questions first. Give me diagnosis codes, procedure codes. Tell me if you want all post-transplant patients or only those treated here in the center. Also, which data fields do you need? Researcher, I'm not sure. Can I look at the records first? Well, you can do chart review for limited number of patients, but then you need to tell us which data elements you need. I need everything. Sorry, I cannot give you everything. It's against privacy protection policy, and so usually some people start crying at this point. And this is really true, and so things change, and UCSF is trying to help and come up with better processes for providing access to data, but there could be better ways of answering these questions. Also knowing that estimated 80% of meaningful medical information is contained in the free text clinical notes, as opposed to structured data fields. There is some hope in NLP. And I'll give you a few examples of very specific problems that are being solved right now with NLP. And first example is advanced care planning. So I don't know if you know what this term means, but basically it is, in clinical sense, it's when a person gets seriously ill or approaches the end of their life, discussion needs to happen between this person, their family, and the healthcare provider on how they would like to be treated when they are unable to speak for themselves. And this discussion needs to be documented in their health record. So even though most standard EHRs have designated fields for this type of information, due to inconsistent workflows, this information often ends up either in scanned paper forms or clinical notes somewhere, which is very hard to retrieve at the point when it's needed. It actually affects care a lot, and in many cases, patients' wishes are not honored because of how hard it is to access this information. So one way to approach this would be researchers are looking into using NLP to measure to classify basically whether a clinical note is on the ACP topic or not. So another example, which is a little different, this data is actually public with an NLP opportunity. So we recently our team I wasn't working on it much, but my team co-workers were. We launched a clinical trial finder website, which is a patient-centered tool to provide access for general public to ongoing open research opportunities at UCSF. So the tool scrapes information from clinicaltrials.gov, filters it out only to UCSF clinical trials in progress, and tries to display it in a user-friendly way as much as possible. And then, but if you look at the information, it's actually what was submitted by researchers, and it is very, the language is very complicated. And so one application of NLP here would be to translate this very scientific, high-level text into simpler, patient-friendlier text. So generate something out of this. And then another same product, same system. Another example is we have a browse page where, in addition to searching through clinical trials, you could look at browse by categories. So what we did initially, we were in a hurry, we didn't have time to do any machine learning or anything with it. We just manually labeled initial set of trials that we launched the site with. But then all the new information that comes in, if it's not an exact match, it won't be labeled and it will show as like other. So that's another example of where the NLP could help. Yeah, and the third example is really fundamental, which could actually change and loosen the limitation of privacy, is de-identifying clinical text, which is an ongoing initiative right now at UCSF. So there are two teams that work on two different approaches. So first approach is look at the clinical notes and remove unsafe words. Where unsafe would be anything that matches certain patterns, like proper nouns and stuff, and emails and identifiers. And the other approach is converting bag of words into bag of concepts. So in the bag of concepts, where concepts are from domain-specific meta map available from National Medical Library ontologies. So these are two approaches that are currently in progress, and we know that the second approach will probably have limitations unless we apply what you were talking about and try to use meaningful phrases instead as concepts. So, and the takeaways I'm hoping to, or messages I hope to share with you is that we are looking for strong partnerships with people who are ahead of us in data science, and because since we know we're a little behind, but we want to be close to the front line, so we want to choose successful paths and need a lot of advice. We're also looking for ways to popularize this data science in the medical research community. That's why we started our own community of practice, and any advice would be really appreciated here. And here is the Slack channel on UC Tech Slack workspace that we recently opened. You're welcome to join. It would be great to have you there. Thank you.